Hello and welcome to NAMI Delaware's limited time video series, Going Behind the Mask. In case this is your first time hearing about NAMI Delaware, we are a nonprofit organization that advocates, supports, and educates those with mental illness and their family members. I am their advancement manager, and I'm bringing you hashtag Behind the Mask Mondays to help open up the conversation, reduce stigma, and teach you about mental health. I am thrilled to announce our very first guest, Dr. Jason Duncan. Dr. Duncan is a clinical psychologist, cognitive behavioral therapist, and host of Sanity Podcast. You can find him on Instagram at Dr. Jason Duncan to learn more about mental health through his fun videos and helpful graphics. And today we will be answering all the questions that you have for a psychologist. So, hello, Dr. Duncan. Thank you so much for being here today.
Oh, well, thanks for having me. Always happy to be behind the mic, being able to educate people about mental health and just have a good conversation.
So I guess first, just to kind of start off, can you give us a quick background about why you became a psychologist and how that process was for you?
Yeah, I'll try not to tell too long of a boring story. But I started off in college actually as an aerospace engineering major, which is very different than psychology. And I took like the Psych 101 class at Syracuse. That's where I went to college, and I was mesmerized by psychology. So next semester I changed majors, took the different psychology classes, decided I wanted to be in the treating profession and the assessment profession, working with actual clients. And so that's really how I got into it. And then as I was specializing more into therapy, I took particular interest in cognitive behavioral therapy for two reasons. And if people are unsure what that is, I could explain it as we go. It is the most researched and validated treatment. And so I wanted to be an expert at a treatment that has science that proved that it worked. And also just the theory itself made a lot of sense to me that, this is how humans operate and this is how we could treat people.
Great, thank you. So now we are actually going to be answering, we asked a poll on NAMI Delaware's Instagram for what questions our followers have for a psychologist. So I'm going to start with basically just some of the most common questions. And first, I think this is an important one that a lot of people don't know the difference. What is the difference between a psychologist and a psychiatrist, or anything else in that realm that people often get confused about?
Mm-hmm. Great question. So I'm going to give you a really nutshell answer, and then I'll give you a little bit more detail. So I'm a psychologist, and psychologists typically focus on doing therapy, and we also do assessments, particularly assessments where we do measurement, meaning like everybody heard of IQ testing or testing for learning disabilities. And back in the day, like on TV, see those like ink blot tests. Those are psychologists doing the ink blot test. So we do testing with assessment measures. Psychiatrists, on the other hand, have a main focus in medication. So psychologists do not prescribe medication, psychiatrists do. Now, that's kind of a very strict boundary that I put there because there are psychiatrists that do therapy, and there's a small segment of psychologists that do medicine, but that's pretty uncommon. That's only in a few states, so we'll just put that to the side. That's really generally the difference. The other thing that psychologists do too is that we go to undergrad for psychology and grad school for psychology, so we learn about mental health, but we also learn about like cognitive psychology and social psychology. There's a cool study where if everybody's standing in elevator one direction and you get in face the other direction, sometimes people will turn because they think they're doing something wrong. That's like a social psychology principle.
Yeah, I took a Psych 101 class in college, and that was like one of the first things we learned about.
Yeah. So we learn about human behavior, cognitive processes and stuff like that, where psychiatrists will go to med school and then they'll later start specializing in mental health, but also they're going to have a much broader medical knowledge on that side. So they could take it from a lens, understanding how biology might be impacting mental health. Even though we sort of minor in that, they're going to definitely have a major in that. So our brothers and sisters in psychiatry are extremely important. And I myself have people that prescribe medicine that I am in close contact with, and we work together to try and treat patients the best we can.
That's great. Actually, one of the questions that was commonly asked, and I guess a psychiatrist would be able to answer this better, but I'm sure you can as well. people want to know, like, do I need medicine to treat my mental illness? How do I know when that's appropriate? Will I be on meds forever? We did have a couple questions about that. I don't know if you'll be able to answer that.
Yeah, so that's a great, so I can answer part of that. So there's actually some newer research that shows that some people just respond to medication better. This for depression
Mm,
specifically. It's a new
okay.
line of research. We don't know it broadly, but for depression, there's some people that just respond better to medication, and there's some people that just respond better to therapy, which is really interesting. And they're going to have to look more to see this. And it took them a very long time to do this study, and they have to do these like really like expensive scans in order to do it. So it's not
Mm,
practical to sort of put out there. But
yeah.
some people really do benefit from medicine. And I'll tell you, often my approach is like, let's try it without the meds. And if we're not getting where we need to without the meds, like
Mhm.
let's go ahead and get that consult. So I'll give you one example is that we do this type of therapy called exposure treatment, and all it means is facing your fear. We know this very well with kids, right? If a kid is scared of the water, what do? A bunch of people said throw them in. That's not nice. Don't throw them in. Gradually bring them into the water. But you get the principle. Kids are scared of the dark, bring them into the dark. Kids scared of dog,
Mm,
pet dog. So you do that with adults too. So if someone is scared of, say, embarrassment, we'll purposely do embarrassing things in order to get them used to that anxiety, and it goes away.
yeah.
But sometimes people feel so anxious when they're trying to face their fears, the medicine could take the edge off so they could better engage in that therapy. So that's also another way that it could be a very good combination. Or say with depression, if somebody's just so depressed that they really can't
Mm,
see how they're being too dark and negative, sometimes the medicine could pull them out of it enough where we could work on therapy to actually make sustainable change. So yeah, as for how long you need to be on the medicine, I'll leave that for a psychiatrist. Some people see it as bookends, like those people I'm talking about, where you
mm,
help pull them up or down a bit with the medication, do the therapy and taper off. Where
yeah.
there's probably some people where they're going to recommend taking medication, but there are some conditions where, like say, like a bipolar disorder or schizophrenia, something like that, where it would be persistent medication to help control those symptoms. So it's a bit different depending on the disorder.
That's a great response. Thank you for that. I think that'll
Hmm.
clear a lot of things up. I know that there has been a lot of stigma in years surrounding medicine. But I think something also I've seen is that people are looking for the quick fixes. So, if they're feeling anxious, they'd rather honestly take medication than go to therapy. Like they think, oh, I'll just take the medication. That way I don't have to deal with my issues. What do you say for those kind of people? Like, do you think that therapy always has to go with medication?
Well, so for the most part, for therapy to work, you want to be in therapy and you want to engage in those things. And sometimes people just aren't ready or
Hmm.
ready to do that. And maybe they'll be ready later. So there's nothing wrong with being a person that says, you know what, I think that I want to go the medication route. And if it works, that's great. But the question is, what happens if you're not getting the results that you're looking for on the medicine? Some
Yeah.
people do. Other people
Mhm.
don't. And it's kind of like the flip where I said, like, oh, let's try the therapy. And if we're not getting far enough, let's try the meds.
Yeah.
Well, maybe those people try the meds. And if they're not getting where they want to go to, they consider coming
Mhm.
to do the therapy side. And then there's also, and this is more for our med people, but people have to manage the treatment effect of the drug plus the side effect of the drug. I'm feeling better, but I'm also getting this. And is that balance worth the result? And some people, it's absolutely yes. And there's other people that I've seen that the answer was no. So,
Mhm. That makes sense, sir. Great, thank you.
mhm.
So our next question, how do I find a therapist that is a good fit for me?
That is a fantastic question. And the answer is it's hard.
Mhm.
Because people come to me for referrals, and there's some people that I will send them to that I know in my close network. But say that I have somebody in California or Florida that says, so I'm in New York. Can you help me find a therapist? I try and go on and help them, and I find it really hard, and I kind of know what I'm looking for.
Yeah.
So, but let me give some general advice to help people. One, I always do a free consultation call with people for about 10 minutes so they know who I am, what my treatment approach is, and just see if they like me. Maybe they hate me at the end of
Mhm.
it. Who knows? Hopefully not. But
Do you
yeah,
have I need to just like go off track for a
yeah.
second. I mean, I think it just comes to like being honest with yourself, but like do you ever get offended? Like if somebody, is like, I don't think you're the right fit for me, like do they just
No,
say, I think I need somebody else and move on?
no, yeah, and that's fine. That's absolutely
Mhm.
fine because just like not everybody's going to like you in your social life, you're not going to be a good fit for everybody in your therapy life, because therapists have a personality and an approach too. And that's not going to work for everybody. So I know very well that there's just some people that I'm not going to be as helpful for as if they go to somebody else. So definitely not offensive. And really the goal is for you to get the treatment that you should be getting. And if it's not me, then I would want to help you try and find someone else.
Yeah, that's a great approach.
Yeah. So I would definitely call a few therapists and talk to them and ask them about their treatment approach and things like that, and just see if you feel like it's going to be a good fit. We know that the connection between you and your therapist is one of the biggest predictors between getting better. So definitely do that. Not all therapies are created equal, and this is kind of like my tagline. There are some therapies that have a lot of research behind it, and they tend to be skill-based therapies, meaning we teach you the theory, we teach you the techniques and skills to treat whatever is going on, and then you learn to do it to become your own therapist. And we know skill-based therapies tend to work better. So one thing I would look at is what type of therapy is your provider doing, and spend a little time researching different therapies just to see what you think would fit and make sense to you. There are so many different therapies, and a lot of people call up, they don't know there's different therapies, and the therapy picks them. Right? They call up, I like this person, they go in and they have no clue. Oh, what therapy were you getting from your last therapist? I don't know. Okay, well, what were you doing? Then I have to try and figure it out. So there's cognitive behavioral therapy, there's dialectical behavioral therapy, there's acceptance and commitment therapy, psychoanalytic therapy, psychodynamic. So I could keep going, right? So I would also recommend people don't let the therapy pick you. You go ahead and pick the therapy and see what makes sense to you. If you're interested in skill-based therapy and empirically supported evidence therapy, two places to go to look for that is the Academy of Cognitive Therapy. And I think they rebranded to the Academy of Cognitive and Behavioral Therapy. They're going to have a roster. And ABCT, which is the Association of Behavioral and Cognitive Therapy, they also have a roster too. So those people are going to be some branch of CBT likely. As for the Academy to be on that roster, I'm pretty sure the Academy does a certification.
Okay.
So those people are certified. And then lastly, the Beck Institute. Lastly, but not leastly, the Beck Institute also has a roster, and the Beck Institute was started by who we call the father of cognitive behavioral therapy. And they have a roster of people that they trained. Psychology Today is where I put my stuff up. So if you go to Psychology Today, you could search also word of mouth. Other people that have liked their therapist that, you could trust that, or asking your physician or psychiatrist who they like too.
That's great. Thank you. So for our next question, this is kind of a fun one, I guess. Do you psychoanalyze your friends and family? Like, are you just sitting and thinking like, oh, I wish I could, give you this therapy advice, but like, I don't want to be a therapist around my friends and family. Like, what is that like?
100% of my day is analyzing everybody. No, not at all. I get asked this question all the time, and this is a joke when people say, "Oh, what do you do?" And I say, "I'm a psychologist, I'm a therapist," and they go, "Oh, did you analyze me yet?" And I'm like, "I wish I could analyze you that quickly. That would be great." What I would say in this, and you know this, and I'm sure everybody's listening that knows this, that all human beings are like mini psychologists or therapists.
Yeah.
And we're built that way because we're social animals, and we're always trying to figure out other people, and particularly the other people that are around us. How do they work? Why do they work? And we don't come with a like a blueprint or like a manual, like a coffee machine of how humans work. So we have to figure out and come up with theories. And that's why over time, there's been so many different theories behind human nature that you can read about philosophers and stuff like that, because people have always been figured. So everybody's kind of like a mini psychologist. So what I would say is that I personally don't analyze anybody more outside of work than what anybody else does. But I think is it an analogy, a metaphor, whatever? I'm not an English major. What I could say it's similar to do is like a musician listening to music, right? We both might be listening to music, but a musician knows like theory and notes and combinations, and they can sort of hear things and hear things that we're not hearing, and can put words to it and labels. So I think that's the difference. It's not more, but I just have a system to do it.
Yeah, that's great. Do you ever have friends or family that come to you and like want your advice, like, like a therapist perspective on like this issue? And like, are you like, nope, I can't be a therapist any longer? Or to you, like, what is that like?
Yeah. You know what it is that you kind of shut off the deeper dive and you just respond like a person.
Yeah.
Like, oh, me and my girlfriend got into a fight. I want to talk about it. Okay. let's talk about it.
Not that
You
way
know,
to
you just
yeah.
kind of leave it. But at the same
Yeah.
time, there's nothing wrong with saying like, I think that there might be something here. So maybe you should go talk to somebody or give a referral
Yeah.
or something like this. But yeah, we're not supposed to be doing deep dives into friends and families' minds and going underneath and stuff like that. Yeah.
All right, now to a more serious question, I guess, back on
Hmm.
track. At what point do you think people should seek professional help? And I know that might look different for, each person, but I think generally speaking, when do you think people, when it comes to just, oh, I'm having like a bad mental health day versus, this is a long issue. Obviously, I think if you've been through trauma and things like that, there are certain things that I think you should seek professional help. But when it just comes to like every day, I'm not clinically depressed, but I've just been struggling. Like, do you think that they should be
Hmm.
seeking professional help, or what is your personal opinion?
Yeah. So I think this is another complicated answer, but I'll give you the simple response and I'll, go on. So the two words I think about is intensity and duration.
Mhm.
Right. So is it super intense? Right. So that's something you should get help with. And if it's something that's a bit more moderate, but it keeps going on, that's probably something that you should
That's a good way, yeah.
get checked into. Some other indicators, and the DSM is like our diagnostic manual from it. And you
Mhm.
always see in there like causes functional impairment at like work, social activity. So the thing is that if your symptoms are causing problems at work, interpersonal relationships, or you're in a lot of pain, that's probably a good indicator to come in. But right there's this idea of this like disease model versus a prevention model, and
Mhm.
I advocate a prevention model, meaning and you see this in medicine. So rather than waiting till somebody say gets diabetes or high blood pressure and then trying to treat it, well, why don't we try and prevent it? So we go for checkups and someone says, your sugars are getting higher, your blood pressure is getting higher, we
Mhm.
need to exercise, we need to diet. So right, so people can wait until they're at a certain level of distress that they're, and now a clinical range, and come and get treatment. But it's also very good if you feel like you're getting to a place where it's getting too intense, to come earlier on, because the earlier the intervention, the better likely we could help you, that the duration is going to be shorter, and
Mhm.
that it would be less intense together.
Yeah.
So, but there's some people. So here's the cool thing about therapy is that um, a lot of it is treating a condition, but there's also some people that just want some help navigating some issues. And so
Mhm.
that's fine to come in to try and navigate some issues. But I think the important thing for therapy is some people do it, every day. I mean, sorry, every week, and they keep doing it because they like that support system. But also, therapy very much should be considered a short term thing. There's
Mhm.
something going on I need help with. Let's address the problem. And when things resolve, see you later. Call me when you need me.
Yeah, that's a great way to look at it too. Yeah, I think a lot of people think that it has to be this forever thing.
Mm-mm.
So that's why they're, sometimes scared to take that leap where, you can do it a couple times and get that help you needed.
Hmm.
And something that you mentioned that I want to point out too is how saying, like, you go for your checkups. If your blood sugar was low, you would treat that. And that's something that NAMI Delaware, we always advocate and say that we should be treating our mental health like our physical health, and in so many other ways too. Just how if you're, you wouldn't be embarrassed to say, like, oh, I need some help. I broke my foot. You shouldn't be
Hmm.
embarrassed to say, I need some help. My mental health is really struggling. So
Hmm.
I was just really glad that you brought up that point.
And just one thing to add there is that if you're a person that knows that there's something that you like, you tend to get depressed, or you tend to have
Mhm.
flare-ups of anxiety, of OCD. What when you feel it coming, right? There's maintenance things that you should be doing in between, but oftentimes like things will resurge. And if you feel like things are starting to build up and you're recognizing those patterns, like come in sooner rather than later, because again, early intervention is always better.
Mhm. Great. Thank you for that.
Hmm.
So now I actually have two questions for you as we wrap up our conversation. This will be something fun that I'll be asking all of our guests.
Hmm.
So the first question is, what is your go-to for self-care? And your second question is, what is your favorite affirmation? Or I don't know, to put you on the spot, if just like a couple that come to you, or if you do repeat anything to yourself, like when you're struggling with your mental health. Um,
Hmm.
so self-care and affirmation.
Sure. So self-care, there's some really just general things that you could do to help keep your mental health pretty okay. And it doesn't require like facing your fears or doing deep
Mhm.
dives into your psyche. So one of them is exercise. humans are supposed to move. And we know that 30 minutes, 5 days a week of moderate intensity exercise plus can be just as effective as antidepressant medication. And that's great. So if you want to just have general well-being boost, decrease anxiety, decrease depression, exercise. This is a new budding kind of area of research to a degree, but it's been around forever, like food be thy medicine. Like,
Uh-huh.
they've been saying that since ancient
Yeah.
Greece, right? And now people are like, oh, wow, yeah, okay, that makes sense.
Uh-huh.
So they've done some research study looking into diet. And like, for example, the Mediterranean diet has been shown to help treat depression. And that's great. So, exercise, eating, sleeping, making sure that you sleep your 8 hours or whatever you need per night that you generally should be sleeping is super important. Oh, okay. So I'll leave it up there as like general self-care. There's some like deeper things that we could talk about, but there's
Uh-huh.
some very general things. Oh, the last thing I'll say is work-life balance.
That's a yeah.
It's good to be like motivated and want to do well at work, but there are so many other areas of your life that are super important. And if
Mhm.
you neglect those, you're going to be neglecting yourself too. And there was this study called the Harvard Men's Study. Women were included too, but they looked at all of these different factors, and it was a super long study. But at the end of it, what they found was your relationships was the biggest predictor of happiness, living longer and healthier. So put a premium on your relationships. There's people out there that love you, that you love. Make sure that you're spending quality time with them, because that's what's going to mean that's what's going to mean the most to you. So
Mhm.
definitely include that in there too.
Yeah.
As for my favorite affirmation, I'm not sure if it's an affirmation, but I love the phrase, this too shall pass.
Yeah, that works. Mhm.
Love this too shall pass, because no matter how hard things get, because it's not like psychologists or mental health professionals don't get sad or depressed or have
Yeah, I
grief
think
or
that
get
is a
anxious.
very common myth.
Yeah,
Like,
I mean, I've been dumped before and I've been really sad.
uh-huh.
There's things that happen. I've failed at things, but I remind myself like this too shall pass, and it always has, right? This bad time in my life has always passed, and things have gotten better. So I would recommend that when you're in a tough place, just remember this too shall pass. And sometimes if you get some help, it will pass quicker.
Yeah. That's great. Yeah, I just love like the image of a wave and just thinking, you have like you'll feel it and then it will pass and you'll be back again and everything will be better. You're not gonna be going through this forever. And I definitely agree that, even if it's not going to therapy, just talking to somebody, talking to a friend helps you, get past that wave just a little quicker.
Mhm. And just spending time with people is real, well, healthy people for you, I'll say,
Yeah.
is really healthy for you. And we all know, and so I know I talk about dumping a lot, but imagine if your friend just went through a breakup and instinctually what you do. Let's go out and do something.
Yeah.
Right? Let's go get some food. Let's go take a walk. Let's go. Let's go. Let's go. Because we do instinctually know that when we're feeling down or overwhelmed, interacting with good people and doing something
Mhm.
really improves your mental health and makes things better. So
Yeah.
when you're feeling down and out, spending time with quality people is really recommended to help you pull through it.
Yeah, that's great advice, and that always helps me. Um,
Hmm.
so thank you so much for joining NAMI Delaware today. And I mean, I have learned so much. Even I'm sure all of our listeners have learned so much. Is there anything else that you want to add, or also can you tell our viewers where they can find your podcast?
Yeah, sure. So my podcast is on every major platform. Most people use Apple or Spotify.
Mhm.
So you could just search Insanity. If you're watching the video, you'll see like me and like this blue background, but there'll be a person that says Sanity with Dr. Jason Duncan. And we have episodes from general mental health on to talking about specific disorders and treatments for that. So it's a pretty good resource for people that want to learn more about psychology, mental health, and empirically supported treatments. And then just to keep up with some of the tips and tricks you said in the beginning, you can follow me on Instagram, and I'm trying TikTok at Dr. Jason
Exciting one.
Duncan. Say that again.
It's an exciting
Oh,
platform.
it's an exciting platform, all the dancing and everything. We'll see what
Uh,
happens. So it's Dr. Jason Duncan on both of those platforms, and you could also check that out.
All right, great. Well, thank you so much. We really appreciate you, especially being our first guest and kicking off this mini video series.
Great. Thanks for having me. It was a lot of fun.
All right, bye. Before you exit, I have a short message from NAMI Delaware, and that is, you are not alone. There is help and there is hope. We are encouraging you not to hide behind your mask this holiday season, instead to talk openly and honestly about your mental health. We talked a lot about finding different resources and how to find a therapist good for you today, and I just wanted to let you know that if you do live in Delaware, NAMI Delaware has a helpline. It is not a hotline. It is not for if you are in crisis, but it is more of a resource line. We provide you with different resources. If you don't know where to go, but you need help, you don't know what your insurance covers, we are here to help you find the right care and support that you need.